Hello, everyone. A very good afternoon, everybody. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: benign prostatic hyperplasia, or commonly known as BPH. Benign prostatic hyperplasia is the non cancerous enlargement of the prostate, usually begin in the 50s in men, which in many men cause obstruction to urine flow. Many men have to get up and go to the toilet at late night, and it is the most troublesome aspect of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as theater or cinema rather difficult. A doctor, such as a urologist, can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Anuj Kumar Yadav, MBBS, MS, MCH Urology, consultant urologist, andrologist, robotic and reconstructive surgeon. He is a rich experience of and hands-on expertise in benign prostatic hyperplasia BPH management. He is currently working as a consultant at Park Hospital, Sector 47, Gurgaon, Haryana. Dr. Anuj Kumar Yadav has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. First of all, welcome to you, doctor. And our first question for you today is, what is BPH?
BPH is a non-cancerous enlargement of the prostate gland. It is generally present in all male, and under the influence of hormone, as the age progress, the testosterone decreases and the estrogen increase. So, under the influence of hormone, it is a non-cancerous enlargement that will progress and that will obstruct your urinary pathway. So you may feel like symptom of frequency, urgency or nocturia. It's like आपको बार बार पेशाब जाना पड़ रहा है, आपको जब पेशाब की लगता है तो आपको ऐसा लगता है कि जल्दी से कर लूं, या फिर आपको रात को बार बार पेशाब करने के लिए उठना पड़ रहा है. तो इफ ये आपको ये सब सिम्टम है, देन यू हैव मस्ट बी हैविंग ए बीपीएच.
राइट डॉक्टर, इसके कारण क्या हो सकते हैं? व्हाट कैन बी द कॉजेस ऑफ बीपीएच?
There is nothing, only aging under the influence of hormone. It is only the cause. Otherwise, no correlation with the environmental factor and diet.
राइट डॉक्टर, सिम्टम्स किस प्रकार के होते हैं इनिशियल स्टेज में, और धीरे धीरे जैसे प्रोलॉन्ग होता है हमें किस प्रकार के सिम्टम्स नजर आते हैं?
Initially stage you have frequency, increased frequency, urgency, you have low stream, you have nocturia, you have sense of incomplete evacuation, you have a feeling of stream is very poor. So these are the symptom you need to know. And if you have, if these symptom progress over the time, that means you have BPH and that is progressing.
राइट डॉक्टर, इन सारे सिम्टम्स में से सबसे ज्यादा प्रॉब्लमेटिक सिम्टम्स क्या हैं?
सबसे ज्यादा problematic symptom है nocturia, because the patient had to wake up at the night in the middle of
राइट
the sleep, and for that he may have some dizziness and he may fail and he may have fracture. So
राइट
frequency most important in nocturia, and after that frequency and urgency are the equally important.
राइट डॉक्टर, व्हाट आर द ट्रीटमेंट्स अवेलेबल राइट नाउ फॉर बीपीएच?
For the early stage, there is a medical therapy. You start a medication you take at night, and your prostate will stop enlarging further, and then your symptom will reduce. So the primary treatment is medical management with the medicine only. If patient have deteriorate present in advanced stage, like kidney function are deteriorating, he's having recurrent urinary tract infection, or he having recurrent hematuria, then we need to proceed for surgical management.
राइट सो डॉक्टर, now that we know about the symptoms, the causes, and what is BPH, how can one uh, you know uh, try to avoid BPH? As you said कि बहुत common है, एक एज में आके सबको शायद फेस करना पड़ता है. But if we want to prevent ourselves from having it, what are the ways?
Generally, there is no preventive studies you can prevent it. Only you can treat it early. or if there are few studies, they said ki vitamin D intake will reduce, or there is no proven factor that will say ki BPH won't occur. But you have to recognize it early and you start treatment early.
Right. Uh, Doctor, what are the things which can worsen BPH? Is alcohol or smoking included somehow in the category?
No, at the no direct correlation, but smoking is said to be one of the cause of may increase the chances of BPH.
Right,
Alcohol, as per se, not so much.
right. Has a diet any role to play in BPH as well?
No, no. Only it will prevent the UTI part, but the BPH progression will not be stopped with the diet.
Right. Uh, Also, doctor, do we see the BPH arising mostly in obese patients? It be another reason?
No, no. BPH not in only obese, you can get in thin patient also. But BPH symptom were more in obese patient, but at present no distinction between obesity and BPH. While
So, doctor, yes, yes.
is if it's a cancerous enlargement, then yeah, definitely if it's cancer prostate, then it might be because of the obesity.
Right. So, doctor, can maintaining a healthy lifestyle or regular physical exercise
Yeah,
anyhow help
definitely.
us in managing it?
Yes, definitely. If you do regular exercise, if you be healthy, eat healthy, then your testosterone level will be good. Then you automatically your prostate will be not enlarged early.
Right, right. Doctor, I can see a few questions coming up from our viewers. We have Ajit Singh asking, how important is regular exercise in managing BPH?
As per se, it's not for the short period. You have to do exercise for long period. That will maintain your hormone level and your healthy cortisol and testosterone level, and that will have delayed progression of BPH. You will experience symptom later in the stage of like 80s, 90s instead of 50 or 40.
Right.
Yeah, regular exercise.
The next Yes. So the next question comes from Arham Khan, who asks, can you explain the different surgical options available, their benefits and potential risks?
Okay. So we have the first basic and the gold standard surgery is transurethral resection of prostate. It can be done with the monopolar or bipolar, but depend on the size of the prostate. We generally prefer. It requires surgery. There are so many options. It's like prostatic lift, resume. We have bipolar inequalization. We have laser inequalization like TULAP, OLAP. But it all depends on the patient factors as well as the size of the gland. If patient and gland is enlarged, the better will be laser surgery. With that, we do TULAP or HOLAP. If patient is early stage and size is around 50 cc, 60 cc, we do standard URP.
Right. Uh, Doctor, also we know that BPH causes the tendency of urination or maybe nocturia, as you mentioned. So how much water should a normal patient intake while they are suffering with BPH?
No, no, they shouldn't decrease their. Actually, they shouldn't take water intake around 2 to liter per day, but they should decrease their water intake after 5 p.m. They should avoid alcohol intake like after a beer they convert itself to whiskey, or they should restrict their water intake in night and avoid coffee and tea because it will increase further formation of urine and further your symptom will be worsen.
Right. So we are saying that intake should be normal, just like we are normally having it. Just that after 5 p.m., we have to decrease the intake of water. Right. Doctor, another question comes from Aditi Shivrastava, who asks, Doctor, my brother is member facing this issue. Can you please tell me how long will my brother need to take the prescribed medications and how will their effectiveness be monitored?
Okay, that's only basic thing. Do you the medicine to be taken for lifelong? If he is on a single alpha blocker, it to be should to be taken lifelong, or if he is on a combination of alpha blocker as well as dutasteroid, then we can switch to dutasteroid after 6 months to 1 year. Only single medication, but he have to take medication lifelong, or he had to undergo a surgery if we don't want to take any medicine. Or if on the future, if the medicine effectiveness fails, then he need to go under surgery.
राइट। डॉक्टर, वी ऑल्सो गेट टू सी कि शरीर में कोई भी बीमारी हो, उससे एक नया बीमारी अराइज होते हुए हमें नजर आता है।
बिल्कुल
बीपीएच के केस में ऐसा कुछ है कि
बिल्कुल,
कुछ और
yes,
हमें।
definitely. If you like just today, I operated a patient. He ignored his symptom, and because of
हम्म।
that, his bladder is so weak, and his both kidney were dilated and poorly functioning. The both kidney are deteriorated in function. So prolonged BPH will deteriorate your kidney function, and you move on to for dialysis and further. And the further your BPH can cause formation of stone in bladder and trabeculation. Okay, and recurrent
राइट।
urinary tract infection. So will lead to sepsis, ICU ventilation. So BPH itself can cause further any other disease.
Right. Also, doctor, our next question, I think the answer will bring a sign of relief for all the viewers who are watching us right now. Doctor, can BPH be cured completely or not?
Yeah, I'd say if you go surgery and it would be very well, you can be cured, but it's not 100% that it won't happen again. But 99.99% it won't happen again if it done perfectly. If it won't not done, yeah, done somewhere else or by an inexpert, it can occur.
Right. So, in order to get it completely cured, what should one do? Go and visit the expert in the early stage? Is that what we are
Yeah,
suggesting?
best thing is when you have symptom, visit your doctor and get operated as early as possible.
राइट। वेल दैट्स व्हाट वी ऑलवेज से आवर व्यूअर्स, कि आप कोई भी बीमारी को ज्यादा नहीं बढ़ाएं, उसको अर्ली स्टेज में ही रोक दें, विच इज व्हाई वी शुड ऑलवेज सजेस्ट कि आप सालाना एक बार एटलीस्ट अपना बॉडी चेकअप करें। आपके शरीर के अंदर कोई भी इशू हो रहा है, प्रॉब्लम हो रहा है जो आपको समझ में नहीं आ रहा है, मे बी आपको सालाना चेकअप से या एवरी क्वार्टरली चेकअप से हमें पता चल जाए द रीजन व्हाई वी ask our viewers to go through it, और जितने भी पेशेंट्स हैं हमारे बीच मौजूद। डॉक्टर, आई थिंक आज हमने बहुत कुछ जाना बीपीएच के बारे में, इसके मैनेजमेंट के बारे में, ट्रीटमेंट्स के बारे में, ऑल्सो द सिम्टम्स, क्या क्या वर्स्ट सिनेरियो हमें हम देख सकते हैं। पर आप, अकॉर्डिंग टू योर एक्सपीरियंस, सबसे वर्स्ट सिनेरियो क्या हो सकता है बीपीएच का, अगर कोई जानना चाहता है तो?
Worst scenario will be the patient will have infection, and that infection will go to kidney, leading to pyelonephritis and death. So one should get treated early. And then there is one
So
misconception I will to tell my audience. The people often correlate their symptom with the size of the prostate on ultrasound. They said we have हमारी तो बस 40-30 ग्राम की है, हमें तो इतनी कोई जरूरत नहीं है. तो मैं अपने ऑडियंस को बताना चाहता हूँ कि साइज ऑफ द प्रोस्टेट से सिम्टम का और उसकी मैनेजमेंट का कोई वो नहीं है. इट्स फॉर अस कि ऑपरेट करना है तो कैसे करना है. इफ यू आर हैविंग सिम्टम, इट डजेंट मैटर कि आपको 30 ग्राम है तो नहीं, कोई ऑपरेट नहीं कराना है या कोई दवाई नहीं लेनी है. अगर आपको सिम्टम है देन यू नीड टू बी ट्रीटेड.
राइट। डॉक्टर, एक और सवाल आ रहा है, भावेश मित्तल पूछते हैं, हाउ ऑफन शुड आई अंडरगो प्रोस्टेट स्क्रीनिंग्स और चेकअप्स टू मॉनिटर माय ओवरऑल प्रोस्टेट हेल्थ?
If you won't have any further increase in your symptom or your flow is good and you don't have any recurrent UTI, you can go at 6 months. You can continue your medication for 6 months, and you can after that you can have your bladder check by ultrasound and Euroflow after 6 months. If you have
राइट।
deterioration of your symptom and you have any UTI symptom, then you need to evaluate right now.
राइट। Doctor, well, it was a very informative session today. Before we leave, any take home note for our viewers who are watching us right now?
The we take home message from my side: if you have symptom, see your release as early as possible. Don't avoid it. Don't ignore it.
Well, that was Dr. Anuj Kumar Yadav for us. Thank you so much, Doctor, for your valuable time. It has been quite an informative session for our viewers. We look forward to many more such sessions in coming time. Thank you, viewers, for your excellent participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, Instagram. Thank you so much. Stay safe and stay healthy.